There are some do's and don'ts when you are visiting a psychiatrist for medications. In order to avoid getting mistreated or to remove the fear of treatment, some do's and don'ts will help. They are based on my experience as a clinical psychologist, and it has worked very well with most of my clients. So let's talk about the do's. When you're visiting a psychiatrist for the first time, it is essential that they give you enough time to explain your problem. It isn't possible for a doctor to sit with you for a very long time, like a session with a psychologist, but it is important that you feel adequately heard regarding your problem. Please ask all the doubts and concerns you have around the treatment, whether related to medicine, duration, or cost of treatment. Try and look for a psychiatrist which is near your place or which is available online, anything that you're comfortable in. Because if they are very far and they are not easily accessible, then the treatment gets delayed. You might miss your appointments. If you feel that your doubts and concerns about medications and treatment are not answered by psychiatrists, feel free to go for a second opinion. Once you are satisfied that the psychiatrist has understood your concerns, please stick to the treatment given. Give yourself at least 1 to 2 months to see if you're feeling better or whether a particular medicine is working for you or not. Your feedback is very important for psychiatrists to assess whether a particular medicine or dosage is working for you or not. Three things can happen once you start your treatment. Either you will get better, or you will get worse, or you will remain the same. If you're getting better, very good. Wait for the next scheduled appointment and update the psychiatrist. If your condition is not getting better or it's same, you can go early. Don't wait either to for the next scheduled appointment to come or leave the medication in between and stop the treatment altogether. Many times people who have had bad experiences are those who have not followed up. They get too scared. A very important concern I would like to also address regarding medications is that it has side effects. Yes, definitely. Even a cough syrup or a painkiller has side effects. This is because when we are taking a medicine, we are using an external agent to help us in the healing process. In the case of stress or mental illness, the purpose of medicine is to calm the brain and work on those areas which are affected and causing the symptoms to aggravate. Once we start taking the medicine, it takes time to adjust in our body and begin the work. It is natural to feel drowsy, inactive, feel like sleeping because the brain is learning to calm down. But once you follow up, these symptoms should get better. If they are not getting better, then that's an indication that maybe the medicines are not going right. Some don'ts. Don't search internet for learning about medicines that you have been given. A particular medicine can be used for hundreds of purposes and may be given together with some other medicine. The prescribed medications are based on clinical judgment and expertise of the doctor. The internet cannot replace the years of training that a professional goes through to become equipped to treat someone. If you're confused about why a particular medicine is given, ask your psychiatrist directly. Internet can misguide you and create unnecessary fear about medicine. A good psychiatrist will always answer your queries, sometimes strictly, sometimes patiently, but they'll never be offended by it. Don't become your own doctor. It's a big problem with Indian clients that they stop taking medicines abruptly or take them without supervision. I would repeat, no amount of knowledge or Google can replace the clinical judgment of a professional. In spite of being a psychologist myself, I have never tried to handle my medications on my own whenever I have needed one. I've always trusted my psychiatrist and mutually decided on the course of treatment. Another tip, don't go for a doctor only because he's famous. As a client or a patient, you have the right to question or refuse the treatment you have given. But you also need to be sincere and realistic in following it. The same rule applies as when you're choosing a clinical psychologist. I always tell clients who come for the first time that it may happen that you might like or not like my approach. Does not mean that therapy is wrong. It means that maybe somebody else will click. Sometimes I would help them in finding the right psychologist myself. Whether the medicines make you dependent or independent is based on whether you take an active part in understanding your illness. This is where regular counseling along with medication is important. The medicine can help in immediate reduction of symptoms, where regular counseling can help in long term prevention of these symptoms. If we develop healthy coping mechanisms of handling stress and related symptoms, we will never become addicted to medication. These are a few points I have shared. As a clinical psychologist does not mean that I have an expertise of a psychiatrist. Absolutely not. But based on my experience of working alongside some wonderful psychiatrists and like a lot of my dear clients, and having been a survivor of anxiety, depression myself, I have seen that these realistic approaches have made a long difference in my own life and in the life of so many other people. Thank you very much. Please consider those points.